Awesome. So just so you know, if I love chatting with you, I love seeing your faces. So thank you for logging in. But if you don't want to have your face and everything else appear in the recording, go ahead and block your camera and your microphone. If you have questions, raise your hand or chat with me or unmute your microphone. I'm more than glad to answer your questions. You can also chat with me. Okay. So there is my information on your screen. I am an OSHA authorized OSHA outreach trainer. There is my authorization number. I am not an attorney. I do not practice any of the healing arts. So these webinars are mainly for informational purposes only. A lot is thrown at us. And so Cal OSHA Emergency Standard is effective now, right? So it started November 30th, and we must know what is expected from us. So our learning objectives of the day, comparing the new COVID-19 Emergency Temporary Standard. If you see this acronym ETS, that's what it means, Emergency Temporary Standard, to your current policies and procedures. Number 2, reviewing and analyzing at least 7 of the most critical required components of the new COVID-19 Emergency Temporary Standard that is effective now. I am actually going to delve into the written program, which we call the CPP, the Coronavirus Prevention Program. And we are going to also take a look at some of the key concepts that you as a safety coordinator need to be very familiar with now that this new emergency standard is in place. And the last thing is understanding testing and training at the workplace under these new requirements. As I said, some of us are very sad. This is already thrown at us. Some of us are very happy. I'm very happy. I got to tell you, I'm very happy because the truth is, it has been a headache to have to dig from the many websites and the information from the CDC, the local health department, the California Department of Public Health, Cal OSHA, etc., and try and put together a COVID-19 prevention program. So now with this emergency standard, you are given the exact list of things to include in your program. So they even give you forms on how do you do your hazard assessment. If you followed me, if you've been with me through this 30 weeks, 32 weeks of webinars, you've noticed this is a complex process. Let me see. Lindsay, are you guys hearing me well?
Yeah, we can hear you well.
Oh, okay. Because I had a my headphones and I was distracted by it. I realized right now that I had them connected to the computer. Okay, so I'm glad you can hear me. So now they even give you a form for hazard assessment. How awesome is that? A lot of you really raise your eyebrows when you ask me to do your policy. So when we put together your preliminary policy that did not include this requirement for your CPP, once again, if I say CPP, that means Coronavirus Prevention Program. So for all of those policies I have put together for you, my clients, up until this point, you notice that I made emphasis on you making a hazard assessment. So why wasn't I making the hazard assessment for you? I didn't, because it requires being right there on site, talking to your people and making sure that you know where the hazards for COVID-19, meaning where are you exposing workers to COVID-19 and how can we prevent it? So that hazard assessment took some digging, and it took putting together a form. I put it together for you. We put them in your policies, and you were supposed to be doing this risk assessment. Now they give you a form. Voila, that's awesome. They give you a model program with a form, which is similar to the one I provided to you, and we'll see the aspects that are awesome about it. So those are my learning objectives. Let's get to it. This is cool stuff. And now we'll go flying. I go fast. Some of you tell me I talk too fast. If there's something you didn't understand or I went too fast over, please let me know and we'll review it. Why an emergency standard? I basically explained it right now today. It really clarifies what we have to do to prevent these outbreaks, to prevent the spread. So I got to tell you, when you hire me, for those of you that hire me, that you're still on my waiting list to get your policy done, now we're going to do it under this new model program, and we're going to follow a lot of the new implemented emergency standard requirements. And I love this. So you should love it too. Love it with me. It's going to be fun. At least now we have clear guidance, or more clear guidance. A lot of the very specific related to the specific industry you're in, guidelines still apply. So
Mike, can we do a delivery in Newport Beach today?
Okay, so I have somebody with that hasn't been muted. So make sure that you are muted because this is a meeting that is being recorded. So Lindsay, can you please make sure everybody's muted? And if they need to ask a question, then they may go ahead and ask it.
Yes, I will.
Awesome. That's really great. So who does this apply to? Okay, now everybody get ready to faint, okay? To everyone, to everyone. And I know the actual rule. If you go to the OSHA website, you'll see, oh, there's some exceptions. It doesn't really apply to everyone. But the exceptions are so thin and so crazy that I said, nope, this applies to everyone. So all of you on this call, it applies to you. So the first thing that you need to know is if you already have an airborne transmissible disease standard in place, and this is basically for hospitals, skilled nursing facilities, shelters, homeless shelters, jails, everybody working in healthcare. You already took a class with us, the airborne transmissible disease standard. You've already put together your airborne transmissible disease exposure control plan or referring employer plan, right? Because you've been through all of that with me. And so now you realize that, okay, this new standard or emergency standard doesn't apply to me because I already have my ATD. And when I say ATD, it means airborne transmissible disease standard exposure control program in place. So it doesn't apply to me. Well, it does, because when you do your exposure control plan for the airborne transmissible disease, you realize that some of the workers that are not included in that program, such as your administrative side of the equation, people that do not have any contact with suspected cases of COVID-19, you didn't include them in your exposure assessment. You didn't include them in those jobs with categories with exposure. So now you have to have a separate COVID-19 prevention program that applies to them, which is under this new rule. So it applies to you. It applies to those of you that have people going to work from home. They're all teleworking, but once in a while they come to the office. Okay, so now that blows that out the window because you thought, if I have everybody just teleworking, it doesn't apply to me. Well, you make sure no one comes to an office or a brick and mortar place and then it won't apply to you, right? Because there's no exposure at work. Everybody's working from home. And the next thing is it wouldn't apply to any places of employment where there's only one worker who doesn't have any contact with the public or any coworkers, right? No coworkers are exposed, so there's no on-the-job exposure. And remember, I come from the OSHA side of the equation. I'm an OSHA authorized, so we're going to talk about compliance issues. I am not an attorney, so this is brand new. You have to review everything that we put together for you today. So, but that is key. It applies to everyone. Everyone. I don't care about those exceptions that much because when you really dig into them, it's really somebody with a tiny, one person kind of business that it wouldn't apply to.
There is a
Now they give you
question
a
in the
model program, which is awesome. And we're going to talk about it in a moment. I'm going to show you that model program and how you must compare to what you have and how to ensure that you're compliant with the current requirements. So there's an emergency standard. There's the two links, the one for the emergency standard and the one for the aerosol transmissible disease standard. These are two different laws, right? Two different laws, which basically cover everyone in California. Everyone. So if you're not complying with the aerosol transmissible disease standard because you made that determination that you are not in the list of healthcare and others like emergency responders, jails, etc., the list that the actual standard provides, then you're covered by this emergency standard. And this emergency standard basically says or brings about the following requirements. There's 7 top requirements, right? They require that the employers, let me move this up, that the employers implement a site-specific written program. Well, so this is why I say this is a godsend and this is good for all of us to have. And we shouldn't see it as, oh my gosh, another regulation thrown at me. Because now they will give you a bullet point by bullet point COVID-19 written prevention program requirement. So now you don't have to be doing what we were doing before. Oh, this is your type of injury. We have to dwell from here. We have to draw from here. We have to draw from there. Now they give you the elements of that program. Voila, that's what we wanted. So when OSHA shows up at your workplace, God forbid they'll never show up, you will have a document that complies exactly with what they want. Number 2, address COVID-19 health hazards. Documentation of hazard assessment per 3203B. What is this? Okay. So now there is a requirement, and let me tell you, this is interesting. Now it's the law, it is required of you, but it has been there in the past. So this is why it shouldn't raise too many eyebrows. When they are saying now, I want you to address where are the hazards for people to be exposed to COVID-19 when they're working for you. This requirement has been in place before under the 3203 law for the Injury and Illness Prevention Program. There's an element of the Injury and Illness Prevention Program that says that you must do inspections, periodic inspections, to actually assess hazards. And that's why before you kind of raised your eyebrows when I was preparing your COVID-19 policy, and I said, hey, you got to do a risk assessment. You do risk assessments anyway. So now they want you to do a specific one for COVID-19, right? And so this will actually bring about the practicality of this is the actual discussion of saying, okay, so when we are installing windows, we have to ride together in a vehicle. So now right there is an issue of exposure because you are in the same vehicle, two people have to ride together, right? So now you have to implement engineering controls, administer your hierarchy of controls. For those of you that have never heard of this, in the past, when we discuss hierarchy of controls, that means, eliminating the hazard first and foremost. Second, engineering controls such as plexiglass, partitions, a change in the environment. Administrative control, something that you can do such as social distancing. That's an administrative control. Rotating of personnel so that they don't get affected by this. So if it's a vehicle where they have to ride because you do not have this many vehicles, you're not a ginormous company, and this COVID-19 has already affected your uh, profits, and so you making the efforts to accommodate so that only one person rides in your vehicles would actually play against the profits, and you can show really that it would put you in financial danger. You don't have to do it. You can keep doing that vehicle, two people riding this vehicle, but then you have to do elimination, engineering controls, administrative controls, and last but not least, PPE, right? So you're going to address this and document, okay, these two guys have to write together. Now they're going to install Windows, or they're going to deliver whatever they're going to deliver. And once they deliver, it's a heavy product, so they have to do it amongst two people. How far are they from each other? This is less than 6 feet. This is the hazard assessment that has to occur. So it's site specific. And when we say site specific, we've seen it before. That means how many areas of your company need to have this risk assessment or hazard assessment being done? As many as the different types of industry or types of activities, right? So in your same company, you could have a warehouse, your office space, and a store, retail. So retail, warehouse and logistics, and office space. So now you have 3 different assessments that you have to make, right? So I'm here today to give you the practical side to this, right? Because if we just go into repeating what's already on the website and what you can review on the links, it does no good to you. We have to be practical, and this is the practicality of it. You got to make sure, okay, how many areas do I have that I need to do a risk assessment for if you haven't done it? Because if you were with me, if you asked me and you hire me to do your policy, you already did this. You already did your hazard assessment per the sections of your company. Number 3 is correct unsafe or unhealthy conditions. So now you're going to keep a record of what you thought represents an issue of exposure to COVID-19 and how you're going to correct it. And we're going to see the form they gave us now. So voila, this is awesome, guys. It's good news. It's all very good news. Number 4, provide face coverings. So now when it says provide face coverings, that means you're paying for them, or if they are bringing their own, that you are covering the cost of these face coverings. You're also explaining to them that this is not PPE, okay? And we're going to get into that in a little bit. Provide testing protocols. So now testing protocols become a crucial thing that is now mandated and regulated. And now this has to do a lot with whether this is a single exposure, an outbreak, or a major outbreak. And so we get into single exposure means one person tells you, I tested positive for COVID-19. What should I do? So you're not going to let them come into work. If they are telling you, my wife has COVID or tested positive for COVID, and now this weekend I didn't feel very good, and now I'm not coming into work because I had a rapid test and it came back positive. Now you're going to see, what is the high risk period? You're going to take it 2 days before to see, because about the 2 to 14 day of incubation period. We're going to get there, but provide testing. Who needs to be tested? How many of those tests do you pay for? So in a nutshell, you pay for those tests whenever your worker has exposed other workers, they are considered exposed workers in the workplace, right? And so you are going to pay for those tests. You do not pay for testing that is done if an employee says, you know what, I have, my wife is sick and we don't know if it's COVID or not, but my entire family is getting tested, and they haven't shown up for work. So this is an off work type of thing. Or even if they're at work, but they just want to get tested, whatever they do on their own, you don't need to pay for it. Once they've been exposed to someone that is a case of COVID-19, remember, what is the case of COVID-19?
Sorry,
So,
Alba. We're still seeing the learning objectives? Is that correct?
yeah,
Okay.
no, you shouldn't be. You're seeing in a nutshell what are the new requirements.
Okay, we're still on the learning objectives.
This is not good. Okay, I'm glad you told me that. Share. It should be. So I explain who does it apply to. Then I give you 2 links. Okay. Are you guys seeing in a nutshell what are the new requirements?
Yes, we see that now.
Oh, that's interesting. My screen showed that you guys were looking at this. But okay, so implement site specific. We said site specific, and what does that mean? How many areas? And then addressing the health hazards, which means your site specific hazard assessment, correcting unsafe or unhealthy conditions. And now we have a form for it. Yay! Providing face coverings, making sure you pay for them. Number 5, providing testing protocols for multiple COVID-19 infections or outbreaks. So testing now has a mandated, it's now regulated, and it's basically to those that have been exposed at work. And we'll get into the definition of single exposure, an outbreak, or a multiple outbreak, right? Notifying public health departments and employees. Now, if there's more than 3 people from different households that tested positive for COVID-19 or that are considered a case, right? Those people, if you have 3 within a 14-day period, within 2 weeks, now you are going to pick up that phone and call your local health department. There's also a requirement for notifying the health department of the jurisdiction where that employee resides. And, depending on where you're at, you will see that that also is triggered. The regulation also require accurate record keeping and reporting of COVID-19 cases. So now there's a mandated list of things that you have to do accurate record keeping, because you have to track all of those cases. You have to track them. You have to have the name. You have to have when were they tested, the status of their test, when did the symptoms started, etc. So create a spreadsheet, you guys, because a lot of these things are thrown at you, but some forms are not given to you, some are. The numbers, we know they're increasing. It's an interesting thing what's happening right now in practice. In reality, we have a lot of things going on. Because of Thanksgiving, we have some people that got together, and mainly by the Christmas break, a lot of people might be showing symptoms. You've seen what Fauci's saying on the news. You're seeing all these things. You don't know what's going to happen with your workplace, because you may also have program vacation where your entire plant is going to shut down for a week or so. So right now is the time for you to get together with management and make decisions as to how you want to prevent outbreaks, because we are in the middle of a flu season that's bringing about more numbers, more COVID-19 numbers, right? And if you look at the ages of confirmed cases, the higher numbers are specifically in the ages of our workforce. So ages 18 to 49 is the highest number of confirmed cases, and then 50 to 64 is the second highest. So it's actually our workforce. So that's where you're seeing the spread, right? So because we're seeing this number highest in the age group for our workforce, we must make sure we come up with a plan now during the holidays and after they come back for the holidays. Some of you are putting some flexible policies in place. Some of you are providing testing, paying for testing if they are traveling. So you're asking them to just self-report and say, hey, I'm traveling, I'm actually getting on a plane. And so you want to test them before they come back to work. Whatever you want to do is right now is the time to get together and talk about this, because you may not be required to do these things, but after a case is confirmed in your workplace, then a lot of things will be triggered, and you are now required to test those that were in close contact or are considered close contacts of those workers who are tested positive for COVID-19. So it's better to plan and prevent than to react to all of these people coming back to work and then having many COVID-19 cases and then having outbreaks or major outbreaks, right? We have learned that OSHA continues to cite employers because of not providing medical evaluations or fit testing for people that wear respirators, that we forget to put a written respiratory protection program if we're providing with the N95s. We forget to establish, implement, and update your written respiratory protection program. We're not providing with the appropriate PPE. We're not training. So that's federal OSHA, but Cal OSHA continues to issue specific citations. For example, here we have a healthcare center who was cited, and the first citation that they get is always the same. Employer was cited for not immediately reporting to Cal OSHA serious illness and failure to log the employee illness in their log 300. What happens is you have a case of COVID-19 at work and this person ends up in the hospital. The definition of serious injury or illness by Cal OSHA standard says that anybody who goes to the hospital and is admitted and stays as an admitted patient for more than 24 hours, that's serious enough for you to pick up the phone and call and report this as a serious injury or illness to the Cal OSHA local district office. And you must have your local district office phone number very much available to you and those people making these calls, right? So when we see inspection type, we see complaints. So most of the people that are going to complain are those workers with concerns, with safety concerns, that they believe that you're not doing everything you can to prevent the spread of COVID-19. So if you have encourage your workers to bring up their concerns in regards to COVID-19 so that you can address those concerns before they turn into complaints to OSHA. That's the key lesson to this slide. The next thing is the written COVID-19 prevention program has 10 components that are extremely important, right? So the first one goes into the system for communicating. You have to do, and they give you a whole list. This is just the highlights. So what I'm going to show you today are highlights to the requirements because it's a lot to go through and you can read it on your own. But I want to highlight and give you practical issues or things that are coming up. One of the things that are happening often are that people are afraid and they are going to lie or not tell you that they have been in contact with someone that tested positive for COVID-19. And so we've had the cases where, you know, everybody's doing their own thing. And then all of a sudden someone doesn't show up for work. And then why didn't you show up for work? Oh, I had, car trouble or, I couldn't, babysitter didn't come today, whatever they tell you. And then later on, it just leaks, the information leaks out that they were actually going to a testing site, testing for COVID because their aunt has COVID or because their friend or their roommate had a COVID test and came back positive and they're afraid, right? But while they're being afraid, they're still coming to work. They didn't tell you beforehand because they don't have any symptoms. They just continue to come to work. So through this system of communicating, you actually have to tell your workers, I need to know before you come to work because this could actually expose a whole bunch of people and then I could have an actual outbreak or a major outbreak. Guys, the viral test, the rapid test, which is what you want. If you really want to not halt your production, you want to send these people to get tested. Viral tests, okay? Because there's different kinds of tests. The viral test is the one where they swab your nose, they go deep into your nose or deep into your throat. The saliva test, this hasn't proven great accuracy. So I would really recommend that you continue to do the viral nasal test. Don't do the antibody test because that one only tests for past infection. That is not what you want, like the finger prick and other blood tests. You don't want that. But viral testing, rapid testing takes about 20 minutes. They're going to call you back and say this employee tested negative, right? And you're going to pay for those about 100 to 150, 160 a pop. They're expensive, but you're required to pay for them now under this emergency standard. But now, don't catch me out and say, oh, no, if someone comes and lies to me and doesn't tell me, now I have to shut down my company and test everyone. That's not what I said. There's more to it. It's only actually those people that are identified as closed contacts, right? And so now I want you to keep in your head a number or a rule, the 6 6-15-24 rule. And I'll get to that. But 6-15-24, if you can remember that, 6-15-24, that means anybody who's positive for COVID-19 and goes to work, doesn't tell you anything, later on you'll find out. And then you have these people who were in contact with this person for within that 6-foot distancing rule for more than 15 minutes throughout a 24-hour period. And it could be broken down in, little bits of 5 minutes each, but that's considered a close contact. So the 6-15-24 rule. So if he or she's considered a close contact of a case for COVID-19, somebody that tested positive, now you're going to pay for that test. So now you're going to identify those close contacts. Those are the ones that you pay for. Okay. This is really cool stuff, guys, because if that's the rule, then make sure that if you have areas of work where people need to be somewhat close to each other, make it 7-8 feet distance so that you don't have to identify those as close contact cases, right? Or exposed to this person. So a lot of cool stuff that you need to learn and do, even for training. Space them out, not 6 foot apart, 7 or 8 feet apart if you can, so that if it's a 15-minute training session, because that already is more than 15 within 24-hour period, they were not within 6 foot. So I don't have to test those people, even if someone comes up and says, oh, I have symptoms, right? So system for communicating without fear of reprisal symptoms. You want to know, even if it's flu season, and there are some things such as, when you have a runny nose, it's mostly a cold, it's not going to be COVID-19, but you want them to tell you so that their doctor, their healthcare provider says, this is not COVID-19, let's test you. And they go through their healthcare provider to get that test and do it before it becomes an outbreak and you have to pay for the testing. There's an issue here of notice of potential exposure. So now you have 1 day to tell all of those workers, co-workers, people at work that were in contact with this case of COVID-19. And remember, this is a definition for COVID-19 case. And we actually put it on a slide on our last webinar 2 weeks ago. And that's anybody who has had a viral test and comes back positive, boom, that's a positive COVID-19 case. Someone who has been told by their physician that they are most likely infected and they are infectious and they have COVID-19, boom, that's a positive case as well, right? So you have only 24 hours to give notice. And I've had a lot of questions in regards to this notice of potential exposure. Now, this is where AB 685 comes into place. There are some requirements for that notification within this labor code. Now, please separate these two issues. This is a Cal OSHA. So this is from Title 8 California Code of Regulations 3205, emergency standard, temporary standard. AB 685 is a labor code that came into being and will be in place January 1st, right? So now, the notification right now, 24 hours for you to notify, is as easy as sending an email and say, hey, you were potentially exposed to a case of COVID-19, and you explain what that is. That's all you're required to do under this 3205 rule. Now, AB 685 has more requirements. So the form should be prepared by your legal department. All of you have an insurance carrier, and your brokerage firm or your broker is a very helpful source. They actually already have templates with everything that needs to be included in these letters. It's basically saying to the employee, hey, you were potentially exposed to a person with COVID-19 who is a confirmed case of COVID-19. And, these are the benefits that you have. We're going to ask you to quarantine. We're going to exclude you from work. We're going to ask you to watch for symptoms. We're going to test you, because when you test these people, you can immediately say, oh, you're negative. Let's go ahead and get you back to work, right? Now, remember, with outbreaks, it's a little different, because now you have 3 or more people within 2 weeks. So now you have to test them weekly, right? And major outbreaks is twice a week. So it differs. These are the things that then later on you can delve into and really put it down and understand and learn. And you're going to have it as a reference. When you have your CPP, your coronavirus prevention program, you can refer to this single exposure versus your outbreak versus your major outbreak. And major outbreak means more than 20. Okay. So testing, I've already kind of delved into that, because I said it brings requirements for you to pay for it, right? and requirements for you to inform them where they could get tested, right? Because some of them are going to go through their own healthcare provider, their insurance carrier, and that's perfectly fine. Cleaning, and by the way, I know that you have a lot of questions and I see them popping up. I want to get through some of the basics and then I'll click on those questions and we will start answering questions. In previous webinars, I always answer as I go, but it's important that we get through some of these and then I'll get to those questions. Cleaning and disinfection, soft surfaces, other surfaces. People, your workers don't know the difference between uh, if the virus is going to survive on your stapler versus the couch versus the chair versus the upholstery. Okay, soft surfaces and other surfaces. Soft surfaces may be cleaned as the manufacturer tells you to clean it. And the hard surfaces need to be disinfected with EPA approved disinfectants. Soft surfaces can also be cleaned with approved disinfectants, but you have to take a look at the fabric, etc. It's easier to just isolate those soft surfaces or things such as documents, papers, right? Because when somebody with COVID-19 is at the workplace and spitting on papers and stuff that someone else needs to have access to, how do you clean and disinfect these things? These are things that you need to think. I'm here to talk about practical issues. Isolate those documents and those items that you cannot disinfect. How long do you isolate them? At least 24 hours, but we all know that the virus will not survive more than 7 days on any surfaces. So if possible, 7 days is what the CDC recommends, right? They also recommend that you do not enter a room or an area of what they call the exposed workplace. So any place or area of the work site where this positive for COVID-19 person has been and has had interaction and has touched things, they recommend you that you or the person that is going to do the cleaning disinfection doesn't enter these areas, right? For 24 hours, at least 24 hours. And then they come in and disinfect and you provide the PPE and etc. How to participate in hazard assessment now is another thing in the required written COVID-19 prevention. And that is saying, hey, we want your input. And this is a very key requirement because now your worker, and guys, I have been a proponent of this all along. If you're my client, you know this. I've asked you to always take in account, especially if you have a safety and health committee. That's one of the issues here, a representative from each of the departments so that everybody's represented, not just management, because then management just imposes what they want on workers. Workers have a lot of great information as, hey, you know what? I know you've already put plexiglass in this area. I know we are distance. You even put markings, all about, but so and so. And then they give you the names of 2 or 3 people in a certain job, or while they do this job task, they get very close to me and I feel uncomfortable. If you encourage this reporting, if you encourage this participation, you are going to save yourself a lot of time and headache because this risk assessment will be in part done by your employees as well. Identification and evaluation of hazards. Part of this is your screening. So it's screening procedures should have been implemented a long time ago. This is the sheet that you provide to workers when they get to work to see the list of symptoms. Do you have any of these symptoms? Yes or no? Do you have a fever? You take their fever. This needs to continue happening, right? Next, the documentation of hazard assessment and periodic inspections. It doesn't tell you, they don't tell you how often you need to do these periodic inspections, but you must document them, right? That you're actually doing this hazard assessment, that at any time something changes or you are switching the way something is done at your facility, or you're bringing in a new machine, a new robot that you just purchased to do the soldering or the welding or anything that is brand new needs to have a hazard assessment or an inspection, and you must document it. OSHA will ask for this documentation. This is a requirement now under this emergency standard, the actual documentation of those periodic inspections. So your walkthroughs and your inspections and your correction of hazards is now appearing in a document that they give you as Appendix B of the model program that they provide to you. Okay, and I'm gonna show it to you. This is something that I already talked about, that give notice of potential COVID-19 exposure within 1 business day. Don't reveal the identifying information of the person. During training, I did training yesterday for COVID under this new rule. And one of the things that I emphasize to workers is, number 1, we will protect your privacy. Don't ask. So if you're giving me this notice, who I know who was it? I bet you was so-and-so. Don't Don't expect we're going to reveal the names. Yes, a lot of you will kind of know because the person is not there, or just that one single person didn't come today and yesterday seemed to be fine. Whatever it is, you're just not going to reveal the identification. Also, let them know though that the local health department will ask all of their info, personal info, health info, name, job status, job title, so that you will disclose the information to the health department, so that they are warned beforehand that because this is a pandemic, this is information that will be given to government entities, OSHA as well, by the way. But when you're giving it to the employees who are exposed, confidentiality is protected, right? And then per AB 685, you have to include in this notification the benefits and other information, and what are you doing to correct the hazards, how do you abate it, and the cleaning and disinfection that takes place, etc. That's why the wording, the legal wording, this is a labor code. By the way, OSHA does not have jurisdiction to enforce a labor code, right? But they can use, and they will use AB 685 to actually issue orders for prohibiting use, and OPU is what they call it. And what basically is if they see that you're blatantly exposing people to this COVID-19 hazards and that you're not doing anything to abate these hazards, they are going to stop that area from all work, and they're going to shut down that area of your operations or your entire operation. That's where they're going to get a hold of this AB 685 and use it against you. But they cannot cite you and cite a labor code, okay? So what are they going to use to cite you for any of this COVID-related infractions? 3205, emergency standard for COVID-19, right? Okay, awesome. The notice also may include how and when to return to work and all of the other things required per AB 685. And we did a class on AB 685, so maybe we'll do it again as we've been doing the airborne transmissible disease standard class over and over because everybody's so interested in this. I'll do another one on the AB 685, labor code AB 685. But this is one of those instances, guys, where you have the support through your insurance broker. They have the legal department. You have your legal department where they are supposed to know, your HR department, human resources, they are dissecting this labor code because they need to really provide it according to the regulation, right? So OSHA is all safety of the worker, and rarely they dwell so much into human resources and labor issues, but this one crosses paths, and so they're really kind of including a lot of these things, right? But they cannot cite you under AB 685. They can only use this one, California, Title 8, California Code of Regulations 3205. And then it goes point 1, point 2, etc. We'll see it in your model program. So Appendix A is the form we were all waiting for, that hazard assessment or risk assessment, which we, before this came into being, put together for you. And now you see, oh, well, she was right? We need to take a look at the area of work, the area or the activity. What is the interaction that's happening? What is the work task? What's the process? What's the equipment, the material that potentially exposes the employees? What is the place and time? What is the potential for COVID-19 exposure on employees affected? Here's where you take in account those high-risk people. We have some high-risk populations, either because of their age or because of underlying conditions. By the way, November 2nd, the CDC added a whole new list of underlying medical conditions that are also representing a high risk for severe illness. And when we say severe illness, that means that person has a higher risk to end up in the hospital being intubated, right? Because during training, we talk to people, say, hey, COVID-19 is a virus that actually, we tell them the symptoms, and we also tell them that most of the time, healthy individuals are able to recover and have a mild type of disease. That's how it manifests, right? So you recover at home. But some of these people are at higher risk to contract severe illness, and they may end up being hospitalized, intubated, et cetera. And those people we want to protect under the ADA, the Americans with Disabilities Act. So review that part of the law as well. And telework is magnificent for those individuals who are considered high risk, or older adults as well, the older population. But you do not want to go around and ask, right? You don't want to be asking, oh, so, there's a new list by the CDC. Do you have any of these? No, you encourage self-reporting, and during training, you tell them about the new list, and you can put the list on your screen, show them what are the new list, because it includes a lot of things like asthma, cancer, and it's like, I have 4 slides for you that are included here. I will quickly just browse through them. And the next column is existing and or additional COVID-19 prevention controls, including barriers, partitions, ventilation, right? So this is one form. And I feel like it could be divided into more columns. I'll show you my form that I've given some of you. You can use this or the other one, as long as it includes what they're asking you to include, right? The periodic assessment now also allows for you to record the date you corrected or abated those hazards. So these are the records they're going to request from you. So make sure you have them, right? What are your exposure controls? It goes from engineering controls, administrative controls, PPE, and this is the hierarchy of controls that I was talking to you about. Anytime you have a hazard at the workplace, this is the OSHA 101 lesson, right? If you gotta be very basic, what OSHA wants, and OSHA stands for what? Occupational Safety and Health Administration, right? And here in California, we call it Cal OSHA, California OSHA, right? So what is the basics of OSHA, and what do they want is that you keep a workplace that is safe. So the first thing you do is identify hazards. That's why your hazard assessments, your inspections, your periodic inspections are so crucial to them. And they want you now to document those COVID-19 hazard assessments. And when did you correct this hazard? So for example, if you have a bare or partition status, they are in good condition. Who are the person, or you know what, we have two of them that are broken. Who's the person assigned to correct? Mario will go and switch them. They corrected, December 5th, he switched those two partitions in department A, or in the warehouse, or in the retail area. Ventilation, amount of fresh air and filtration maximized. This emergency standard also brings the requirement for ventilation, for you to actually maximize the amount of fresh air that comes into your buildings. These are great things that were before were common sense, and now you're being directed. Your attention is directed to, hey, open those doors, open those windows, make sure there's enough fresh air coming into. But it comes with a caveat. You got to check for the air quality. Before, only those areas with wildfire smoke needed to monitor the air quality. Now, all of us have to monitor air quality, because you are now required under this emergency standard to maximize the amount of outdoor air. But what if, like those of you yesterday around the intersection of the 71 and the 91, where the bonfire was going, that came known as the bonfire because it started as a house fire and then burned 36,000 acres and still burning today. And the one in the, what is it, the saying, I forget the name of the canyon where the other fire is at. You are supposed to monitor the air quality if you're located in an area with wildfire smoke, and that's a standard for exposure to wildfire smoke. Now, this emergency standard brings the issue of ventilation, making sure you maximize. And whenever there is a major outbreak, now you're required to check your filters, right? And I'll take you there in a moment. So now there's a couple of requirements on ventilation, additional room air filtration, etc. So this is good stuff. I'm sure all of those HVAC people are going to be very busy. So, as everything, some people do very well, some others are really struggling. This is the best thing we can do during this pandemic, is keep our nose clean. Yeah, that's become my motto, right? I know there's a lot going on, but as long as you keep your nose clean, meaning look at the standards, do your best, implement, get people to give you input, change the things you're doing wrong, improve them, and continue to improve. That will play into what OSHA calls good faith efforts, meaning your penalties, if they ever show up to your workplace, will be reduced upon your good faith efforts prior to this standard coming into being that you took over time to actually implement measures to prevent the spread. Number 3, investigated and responded to COVID-19 cases in the workplace. This is not new, guys. I actually gave you a full document from the California Department of Public Health on how to investigate and respond to COVID-19 cases in the workplace. Do you remember this? It looked like this. Responding to COVID-19 in the workplace for employers. And this was revised on September 18th, so we actually talked about it. It actually tells you about the notification to the local health departments. It aligns the return to work criteria with the updated CDC, because if you remember, the return to work criteria here for us was, a person has symptoms, they have to make sure that they stay home or under the care of a physician, but now they cannot return to work unless their symptoms improve and they don't have a fever, without the use of reducing medications, and at least 3 days have passed. That was before. Now that they aligned it on this document September 18th, and they said 1 day, 24 hours. Right? So they changed it. So remember that? It was already there. So now it's mandated. It mandates that you immediately And the word in the standard is immediately. You now have to immediately perform a review of your policies and procedures to prevent the spread of COVID-19. So now you're going to get your CPP out. Once you have this positive COVID-19 case, you get your policy out and say, oh, yes, you know what? In this area, we performed a hazard assessment that was completely or was not focused on this particular activity. So this is where we failed. So you're mandated to immediately perform a review of your current policies and procedures, correcting of COVID-19 hazards per the Appendix B, the form that I just showed you, right? In this form that I just showed you, we saw that you have a column for correction of this hazard. So that's what this means. Number 5, training and instruction. I'm going to give you a list of things that you now are required to train your people in. So the best thing you can do is grab that training sheet with all of these requirements, speak it out loud, discuss it with your employees, and then you're checking all your dots and your T's and you're saying, you know what? In your roster, I not only need your name that you were here for this training and instruction, but now I need an acknowledgement from you that all of these things were discussed. So an acknowledgement form, some of my clients received this from me, where if I did the training for you that was COVID-19 compliant, we went ahead and did a acknowledgement where the employee said, oh yeah, you discussed with me why face coverings are not PPE. You discussed with me how to clean and disinfect and where can I get gloves and all the what's EPA approved disinfectant. So you made a list of all the things you discussed and they signed as an acknowledgement that you actually did training and instruction. So make sure you have a form where they acknowledge, because if you just have a roster, the roster only documents that you trained and that these people were present, but it doesn't really give you an outline. So now if you have an acknowledgement form with all of the things you discussed and an employee kind of review, oh yeah, all of these, oh no, you didn't discuss this with me, then you'll have questions saying that you will assess or address those concerns. So a training and instruction verification of training form or acknowledgement of training will be very helpful. Make sure you prepare one. Number 6, physical distancing. Sometimes physical distancing is not possible because of your processes, because of your actual standard operating procedures, how close you get to do an installation or to do a job. If you're a plumber, if you're a floor installer, if you're a construction worker sometimes, or a person delivering whatever you're delivering, the goods that you're delivering, you may not be able to distance 6 feet because you're doing team lifts or you're working as a team and as a group and you're wearing your face coverings. But sometimes that 6-foot distance, it can't be obeyed. So when that can't be obeyed, what you want to do is just really implement, really, first of all, do the risk assessment and see how you can modify that task so that people are in contact with each other the least amount of time possible. Because otherwise you fall into, if this person comes down with COVID-19, now you have to test all of those in close contact with him and pay for those tests, right? Those bills can get to be pretty large, 5,000, 10,000 every time you test that whole area or a production department, right? So physical distancing also triggers the requirement to see if you need to implement a respiratory protection program. This is new. This is one of those things that I need to highlight for you under this emergency standard. Because you have some areas of work where the physical distancing is not possible, you may have to look into how specialized is that task. The more specialized, the more you want that same person to do it. But what if that person today has symptoms? And this is something that cannot wait, has to be done today. So now you're exposing these people, and now because you suspect they might have COVID, so it kind of borrows a little bit from that airborne transmissible disease standard where they say, if you are going to be dealing with a suspect case of COVID-19, you better make sure you put them on a respirator. So they don't tell you in which instances you have to provide a respirator. So please don't catch me up. Make sure that you know what I'm saying here. It only calls for an actual consideration. And the word in the emergency standard is consideration. So now you have to really, through your risk assessment or hazard assessment, consider whether or not you'd be better off implementing a respiratory protection program to be in place. And I walked you down the practical issues here. Is it something very specialized? Is it something where I may have a person with symptoms that I have to put to work because of this reason? That's where this would come into being. Other engineering controls, number 8, Ministry controls personal. That's the hierarchy that we were talking about, such as partitions, right? Whenever you can put partitions, ventilation. I talked to you about ventilation already. And during outbreaks is a specific requirement. PPE. I'm not going to talk about a lot of the PPE issues. All I need to tell you is this is my 32nd week that we've been doing this, guys. I even gave you the forms. Anytime OSHA shows up at the workplace, they want to know that you provided face shields, because a face shield is PPE, harnesses, gloves, safety glasses, goggles, all of those are PPE articles. They want to see a certification form. Someone assessed the workplace, put down or wrote down that you already went through the hierarchy of controls, and the last layer is PPE, that you assessed it and that you provided PPE upon what is needed for that particular task. Someone signs it and dates it. That's required by OSHA. Non-sharing policies. Now, this is something that has been there before, but now you are telling people, do not share PPE. Long gone are those days when you had your grinder and you hung a pair of safety glasses because you didn't even think as far as providing safety goggles with impact resistant, which is really what you need on a bench grinder, right? But some people had safety glasses and a shield hanging there for everyone who used the grinder could just grab them and put them on. None of that. Evaluate the need for respiratory protection. We talked about that. Okay. 9, reporting, record keeping, and access. So the local health department, we said 3 or more, you are calling the local health department and giving them all the information per the emergency standard. Cal OSHA serious injury and illness reporting requirements, please. One of the ones most cited when you go to that page that I give you the link with my slides, a lot of them are being cited for not reporting when someone ends up in the hospital after being exposed to a case of COVID-19 and they stay hospitalized for more than 24 hours, which is the case with severe COVID-19 illness, right? So that brings about a $5,000 fine. That's an easy fine for OSHA to issue. So make sure you keep an eye out. Track all COVID-19 cases, create a spreadsheet with all the information required, and update as needed. So when it gets the emergency standard requirement gets into tracking all COVID-19 cases, they give you a ton just in a paragraph, a ton of information that you need to track. Just create a spreadsheet and make sure you update and make changes as necessary, right? Number 10, exclusion of COVID-19 cases. We know that whenever someone is a positive COVID-19 case, they can't come to work. Those close contacts that develop symptoms or whoever was exposed for 14 days, they cannot come back to work unless they meet the criteria to come back to work, right? And we'll get into the criteria to come back to work. But it says employers shall exclude employees with COVID-19 exposure from the workplace for 14 days after the last known COVID-19 exposure to a COVID-19 case, right? Some of the key concepts then, so we wrap it up and we get into some of these questions. All right, what is a COVID-19 hazard? What is a test? What is an exposed workplace? And I basically went through this, but this is key, the high risk exposure period. So anytime someone says, you know what, I tested positive for COVID-19, 2 days prior to them testing positive, that's still is considered a high risk period. And then 10 days after that test, even if they don't have symptoms. Now, if they have symptoms, it's different, right? It's 2 days prior to their symptoms, 10 days plus making sure that their symptoms have improved and 24 hours have passed since the last time they had fever without the use of fever medication that helps to bring down the fever. So these are concepts that I put on a slide for you to be very familiar with. You need to really kind of memorize them as you go, right? Because, for example, just if you see COVID-19 test, viral test, it has to be a viral test. If you don't know the difference, go in there and find out what's the difference between an antibody test or blood test versus a viral test, and what are the different accuracy results, right? So non-outbreaks, always use and the 61524 rule, and I want you to remember that rule because it will be very helpful for you to determine who needs to get tested, right? So anybody that was in contact with that case of COVID-19 at the workplace and they were within that 6-foot distance for more than 15 minutes during a 24-hour period, and it doesn't have to be continuous, it could be cumulative, right? Cumulative means maybe 5 minutes in the morning, 5 minutes at lunchtime, 5 minutes when they were getting out of work. So that's 15 minutes, boom. That's considered a person that you need to pay for testing And that's somebody that is considered a close contact or an exposed employee, right? So an outbreak is 3 or more, and a major outbreak is more than 20. And so when you have a major outbreak, you have to provide testing to all employees in the exposed workplace. And so this is an interesting issue because exposed workplace means that area. So when you talk about outbreaks, now you're not talking just about individuals that were in contact with the person that is a case for COVID-19. Now you're talking about a whole area where that person interacted, worked, moved around, went into the bathroom, used the hallway, used the coffee break or the whatever areas that he used. That's the exposed workplace, right? And so basically all of those people in that area need to be tested, and you have to pay for those tests. So even if they were not in the 6-15-24 rule, when it's a major outbreak, you have to provide testing to all of those in the exposed workplace. So it's different. See, those are the difference. You need to make sure you put you keep an eye out for these rules, these definitions. And the major outbreaks also call for implementation of ventilation changes to mechanical ventilation systems, including increasing filtration efficiency to at least MERV 13, which is the efficiency of your filters, right? And that's what the US Department of Energy requires, a minimum of 13. I think it goes from 1 to 19. I don't remember, but 13 is the minimum for those of you who already had a major outbreak. And there's other requirements if you've had a major outbreak, all the way to considering completely shutting down your operation. So in testing, I already discussed this, but here we go again. Provide testing to those that are exposed to a COVID-19 case. And in the case of multiple infections or a major outbreak, implement the regular workplace testing for employees in the exposed areas. Offer testing to potentially exposed employees at no cost and during working hours. You have to pay for that time that they get tested. So a lot of you, what you're doing is, once you know of all these close contacts or potentially exposed employees, you let them know, send them to their cars to wait in their cars, and then you send them to get tested during working hours. You're paying for their time, you're paying for their test. And once you know that it comes back negative, you make the determination to get them back to work, right? The only obligation to all employees is to provide information about testing and where to get tested, but you're not required to pay for everyone's test unless they've been exposed by someone at work, right? And then it gets into the differences between when do you provide testing. So you provide periodic, at least weekly or twice per weekly, depending on the magnitude of the outbreak. So if it's an outbreak of 3 people within 14 days, weekly, and twice per week when it's a major outbreak, right? Training, there's a whole list of training. And in that training, you talk to them about these particles travel more than 6 feet, especially indoors. That's why when you do training outdoors, separating them more than 6 feet, like a 7-foot distance of chairs or markings on the floor, works like magic. Because even if people come back to you and say, hey, I have symptoms, we had training yesterday and I was with 20 people, okay, now you don't have to pay for all that testing because they were separated more than 6 feet apart and they were outdoors. Now, this is an issue if they were indoors, because through training, you've told them that especially indoors, these particles can travel more than 6 feet, right? So make sure you're doing trainings, you do it via Zoom, online webinars, etc. Importance of frequent hand washing. People don't know how to wash their hands. So make sure, I would even monitor how they wash their hands, just randomly pick 2 people and say, hey, wash your hands in front of me. Let's see if you're, and do it during training. Proper use of face coverings and the fact that they are not respiratory protection, because face covering is for you to prevent your own droplets to come out and be put on surfaces, or to spit and sneeze and cough on people. Your face coverings are protecting other people. Yes, there is some degree of protection to the person that is wearing them, but the CDC has put out extensive evidence as to how much it protects everyone else. So you're wearing them for everyone else. Yes, to a degree for your own protection, but it's really for everybody else's protection. And so that's why they can't be considered PPE, because they're not really protecting the wearer. That's the reason why they're not considered PPE. And you discuss this during training, guys, please. Symptoms of COVID-19, the list of symptoms: not coming to work, not lying. One thing that I'm going to leave you guys with here, because there's the list of training goes on. You can read it on your own. But this I'm going to highlight as the last thing that I'm going to tell you to take home with you. Document disciplinary issues. If someone comes to work and they don't tell you their partner, their whoever has COVID-19 and they're exposing your workforce, and after a week that everybody is showing up sick and he's sick and you have an outbreak and you found out that they lied or they didn't tell you or they lied to you, do disciplinary policies accordingly. People are getting arrested for flying knowing that they are COVID-19 positive, right? So that was on the news yesterday. So what are the measures that you're going to put in place? So someone comes to work with COVID-19, discipline them. So it could be termination. It could be, this is your only and last warning, right? Whatever you seem with your HR department that is fair to the degree of the actual violation. But this is a serious health issue. So you should talk to them about disciplinary issues, and you, safety coordinator, must document safety disciplinary issues because OSHA will ask for documented issues of disciplinary action. Thank you so much, you guys. I'm gonna go into actual questions now. Let's see. Lots of good questions, right? It's already 12:02, so I know a lot of you have to go, but let's see. When someone's potentially exposed, how will they know if they fall within the 6 feet for 15 minutes or more if they don't know the person who tested positive? So testing positive will have to do with the employer making, that's why during training, if you hired me during training, I do discuss with my employees, with your employees, the need for them to say, hey, I just tested positive, and immediately grabbing a notebook and writing down or jotting down all the people they were in contact with for the past 2 days. And they don't have to remember for how long. They just write down who you saw from morning to end, 2 days, 48 hours because of the incubation period. They're going to write it down. And now after they do a list of people, now they can say, okay, these people I actually talked to for more than 15 minutes in a day, in a 24-hour period. I actually think I had contact more than 15 minutes. So you're going to ask employees to make a list, and you, employer, you're going to make a list because this is your job. This is what is required of you, right? So you're asking the help of the employee, but really it falls on you to actually make this list of potentially exposed employees, right? If they don't know who the person that it's tested positive, that's lack of training, guys. Why? Because I just explained that was the last thing that I said. I'm going to let you take this one home with you. Someone tested positive, they're not telling you, they're hiding it from you. You're going to discipline, and through training, you're going to tell them this is serious. People are getting arrested in some states because they travel being positive for COVID. This is a health issue. We are trying to prevent the spread. There are laws and there are consequences. So I hope you like that answer. Oh boy, let's see. So some of them I don't understand the question, like how about industrial manufacturing? So I would like to know a little bit more about what the question is about. Alba, can you address whether employees in other states need to comply also? Specifically, a company that's headquartered in California has employees in other sites. Okay, so yes, I have clients with establishments in different states of the nation. Each state has their own OSHA program, or they fall under federal jurisdiction. If you do, you go straight to the OSHA site, which basically it's preventing the spread. They're not as strict as California. So what would I do for you? I would implement my CPP for California to your federal employees as well. Why? Because we're stricter. So just make sure that after you implement it for all of your other establishments, you go back to their site, being Tennessee, Ohio, Wyoming, whatever it is, you go to their website for OSHA website, because each state has their own OSHA website. And if you're my client, I gave you a list of how you check, in which order you check, so that you realize which one's more stringent, which one do I need to obey. But just in a nutshell, the answer is, if you have establishments all throughout the nation, you must make sure that you take a look at whether or not they have a state-approved OSHA. And if they have a rule, because Oregon, I believe, has a rule as well, just like California. So if one of your establishments is in Oregon, they have to have a separate CPP that is according to Oregon laws, right? So you would make a CPP specific to each of the states. And for those that are covered under OSHA.gov or federal jurisdiction, hey, if your headquarters in California, have your CPP for California cover all of your establishments. Very cool. CalOSHA has posted a plan template of their website. Yes, and so the CalOSHA website has the model plan. Let me share it with you guys. It's right here. Right there. Oh, am I showing it to you? Hold on, I'm not showing it with you. I'm not sharing it with you. But it's a very helpful program. I like it very much because it goes into the actual forms, and everything that we talked about is right there. So it gives you the rules, the considerations, how to deal with multiple infection, major outbreaks, prevention if you have employer provided housing. It's really good. So that's great input. Thank you for reminding me to share this. And there's where the whole forms are. The writing in red is actually for you to modify and implement. Cleaning and disinfecting, for example, right here on your screen, it says, describe your workplace specific measures, including adequate supplies, adequate time for it to be done properly. By the way, that I love the writing because it really triggers the thought. Guys, during this flu season and the number of cases going up, we will experience shortages in a lot of things, including cleaning supplies, PPE, etc. Guess what? You're required now to take a look at how to get your hands on these things. So there's some liaisons through your local health department that will tell you, hey, when there's shortages of PPE, we'll give you this number and maybe you can get it through here. You have to take a look into this, really go deeply. Cleaning, disinfecting, same thing. If you can provide them with the usual products, what else are you going to provide them with? That kind of thing. So you're required to take a look at this. The red writing is for you to modify and really do your homework and your thinking and put it together according to this emergency standard. So it's really a great document. I can't see my chat now. Here we go. Let's go testing through the. Is it okay if the employees go get testing through the county? Yes, they can get tested. They have super sites. Your health department has super test sites. They can go through it. I think that they will ask always that they go through their own health plan or health insurance. If not, they can make an appointment to go through it through a free testing site. There's no problem. In my slides, as you know, my answer to that was you're not required to pay for any of that testing, just provide the information. So tell them where it is at, give them the addresses of the super testing and how they need to do it. Put together information for them, please. In reference to SB 11, and that's Senate Bill 1159, do caregiving contractors need to report COVID-19 employees to the insurance carrier? So yes, caregiving contractors. So this is the thing, because you caught me off guard right here with the SB 1159. So now what we do here, and this is a workers' compensation law. See, depending on what you're talking about, it changes to one law to another. SB 1159 is a workers' comp law, so presumption of what is it? A workers' comp for COVID-19. So my best advice in this regard is keep track of them, even if they're contractors, because even in this emergency regulation, we do have the actual requirement, and take a look at this. We do have the actual requirement to provide notification to those people that are not our employees, but are subcontracted or contractors or people that we hire to do a job for us and that we're exposed at our premises. So when it goes to whether or not you have to report it to insurance carrier, remember that the insurance wants to know of everyone that is a case or how things are happening. So if you're my client, every time you get someone that is positive for COVID-19, even if they got it at home and they're telling you right now, hey, you know what, I think I got it from home because I took my child to the park. They're normally not going to give you all this information. Sometimes they do. Whatever they tell you, if they say, I don't know that it happened at work, write it down. That's what's key. Write it down. So even if it's contractor, so-and-so from this caregiving contracting agency was present or has been identified as a close contact for this or came back with positive for COVID-19, write it down. Your insurance carrier will let you know because they're not going to cover this. They'll make that decision. What is important for you to know is you must write it down. Even if it's not work related, write it down. Because what will happen is some people will tell you later, oh, this is work related. but wait a minute, you told me when you first called me that you had been to 100 parks with your child, and now you tell me this is work related. So you will now have documentation as to what the employee told you in the beginning and how it actually moved towards now they think is work related. Please document. So document everything. And then when insurance carrier asks you for this information, you will have it very nicely separated as to who's a contractor and what they told you. Temps. Of course, temps. I said there's a requirement. I think I answered that question with that. If I didn't, please let me know. The standard does not reference close contacts in the testing protocol states exposed workplace. No, so I want to make sure, Shannon, that you take a look at exposed workplace is different from the exposed workplace is taken into account whenever there's an outbreak, right? Because an exposed workplace now becomes the hallways, the bathrooms, the break room, the production area, the department, right? It's everywhere where that positive case for COVID was working at or interacting with people versus, and you're right, it does not really reference those close contacts. It only talks about exposed workplace, right? But because there is this information about who do you need to pay for is the exposed people, and who are those exposed people? Close contacts. So now there is a clarification. Thank you. If employees have insurance and arrange for free testing, does that satisfy the standard? I'm thinking primarily for those that are quarantined and then develop symptoms with a major outbreak. How long do you have to test? 2 times per week. I believe you have to continue to test until you no longer have anybody coming back with a positive test for 14 days. So you continue to do the testing, and then you're watching, and then for 2 days nobody else came back positive. Voila, you're able now to stop the testing. When someone is potentially exposed, how will they know if they fall within the 6 feet? Oh, I answered this one, right? Because that's through training. If a lot of your workers are testing positive and they never knew who exposed them and it's happening at work, someone concealed information from you. So through training and through appealing to their sense of fairness and justice, you're going to tell them, I need this information. We are trying to prevent the spread. This is why these regulations are in place, and give them examples of how people are getting arrested out there, etc. That's why I was telling you this is super important, and you must tie it in with disciplinary action. Appendix A. Lawrence, I'm so sorry. I forgot to share Appendix A with you guys, and it's right here. It's so much to share. An hour is not enough. That's the truth. We'll make another one, a follow-up one if you want. This is, oh yeah, I did share it, right? I did put it on your screen where I said, this is the actual risk assessment. And then I also have an example of what I do for my clients, or what we were doing at some point, which is pretty much aligned with that, which goes step or risk factor, right? Like palletizing, if you're talking a warehouse worker, likelihood of transmission, high, medium, low. Can the risk be eliminated? Yes or no? What are the engineering controls, the administrative controls, or the PPE? So right there on your screen, that's my risk assessment that I put together prior to you guys having a format from OSHA. It's very similar, right? Very, very similar. And it basically fulfills the requirements. Now, what else? What about COVID cases which occur because employees did not follow guidelines, went to lunch together, didn't wear a mask? Once again, through training, you're talking about, I have no control over what you do outside of work. During the holidays, guys, we're going to have increased numbers. This is why it came at a good time that this standard came out, because it allows for us to heighten the awareness, to do training. And one of the things that OSHA is really going to look at is the documentation for your risk assessment, your periodic inspections, and also how often are you communicating with your workers. Any concerns that they have, make sure that you document them and you abate them and you correct them and you document what you did, because we don't know what we don't know, right? And they may go to lunch and maybe hugging and kissing each other when they're at the park with their friends, co-workers, getting into meetings, doing things that we don't know. This is going to happen. It's the holidays. A lot of people got together for Thanksgiving. So now remember, the incubation period is going to hit right before Christmas, right? And so you have to come up with your own mitigation strategies. But one of the best things that you can do is exactly that. Request that the screening is key. And then making sure that you tell them about your disciplinary policy so that they immediately tell you of any symptoms. 14-day quarantine period is more stringent than some of the recent guidance from the CDC just released. It is prudent to follow the more stringent requirement, or will OSHA update this requirement based on the new CDC guidance? If you don't mind, Shannon, could you let me know which 14-day quarantine period are you referring to that is more stringent from what the CDC just released? It's just kicking right
Yeah,
now.
so the CDC just released guidance, basically saying that, employees that have an economic burden or for other circumstances, they can actually reduce their quarantine period from 7 or 10 days. Given that Cal OSHA is saying, it's a mandatory 14, do you anticipate that Cal OSHA will update that guidance, or should we just stick with the 14-day period or quarantine?
Stick with the 14-day period because that's what Cal OSHA is saying. And when I give you guys the order in which you must take a look at the resources available to you, Cal OSHA comes before the CDC. Even for a period of time, we had that 3-day, you cannot come back to work unless you haven't had a fever and symptoms have resolved or improved. And then a 3-day period was requested or required before returning to work per California guidelines. And the CDC had already changed it to 24, and we still obeyed the 3-day. So same thing here, go with the more strict, which is Cal OSHA. And all of these things are the ones that are causing great financial burden on businesses as well. And stakeholders are complaining that Cal OSHA didn't give employers any time to really comment. This is one of the things that will probably come as one of the issues to be discussed in the upcoming hearing. So make sure to participate and follow. Okay, but follow Cal OSHA.
Alba, this is Thomas. I have a question that you answered part of it, but I wanted to see if you can touch on it.
Please.
The question that you answered in regards to the employee that was potentially exposed between the 6 feet and 15 minutes.
Mm-hmm.
The question is as me as their supervisor, when I tell them that they were exposed to a positive, how would they determine if they fall within that criteria if they don't know the individual that tested positive when there's let's say a potential workspace of, let's say, 15 to 20 people?
They don't. That's not their job, and you need to let them know, I am telling you were identified as a potential exposed employee. So they don't know because this is protected confidential information. So through training, you let them know. We're not going to tell you who is the person you were exposed to. So that's information you're not going to know. But what the regulation requires for me to do as your supervisor is to tell you that you were identified as a person who came in contact, who is positive for COVID. And, if it's an outbreak, you're going to tell them, so that the workplace is the place where all of you are going to get tested because there has been an outbreak. And you're not going to tell them who are the 3 people or the 20 people, if it's a minor outbreak or major outbreak. They don't call it minor, but an outbreak versus a major outbreak. You're just going to tell them you've been identified. So what we want you to do is we're going to exclude you, and that's exclusion of these people. They're not supposed to be working. You're going to send them to be tested. So that's the step, letting them know and that they have to get tested, right? So that a rapid test will tell you whether or not they are positive or negative. Make sure it's one of those viral tests that will give you the most accuracy. All of this gets communicated through training. Does that answer the question? They're not going to know.
Yeah, it does. Thank you.
Okay, great. You identify them. You're the one. And that's why through training, I also tell them, guys, if you are positive for COVID, the first thing I'm going to ask you to do is jot down names. Who have you seen in the last 48 hours? And just write it down for me because we are going to talk about which of those people were in contact with you within that 6-15-24 rule. So we're not going to tell the employees that were exposed, but we, the employee that is positive, and me, the person doing the investigation, will actually have that list. Awesome. Okay. Yes, your CPP has to be separate from your ATD exposure plan for sure.
Britza has her hand up, so you can go ahead and unmute yourself, Britza, if you're able to.
Hi, this is Breeza. Thank you. Can you guys hear me?
Yes.
So I just wanted to give a suggestion on the gentleman's question right now regarding the contacts. Just from my experience, given the incubation period and just the timing of everything, when you're talking to somebody about who they've had contact with, obviously people's memories change, people's stories change. So what I highly recommend is the implementation of contact logs. So what we've implemented at our agency is, for example, at our city hall, anybody that's working on site is required to daily complete a list of who they've had close contact with. And now we're even asking them to confirm that they were wearing their face covering. So just a suggestion.
And
Thank you.
it's actually something that is required in some areas of healthcare. So this is a very good suggestion. What it is, these are all ideas in fantastic ways of getting the job done in an easier way. So I appreciate it, Marissa. Greatly appreciate your input. As a matter of fact, many times the reason I don't throw more things such as logs and more documentation is because it's already a lot that is being required from us. But if some of these tools will help us do the job easier, by all means. I love the idea of that log. So thank you. And some people go, oh my gosh. And it takes from production time. See, that's the major issue here many times. But hey, if you put it in numbers, what will cost your facility more money? To take the time to do these logs at a certain time of the day versus now we have an issue of exposure or an outbreak, we got to shut down the whole department, right? And so I have a couple more here. Let's see. And we're going to go till 12:30, you guys. So the rest of you, I will address in by way of email. Did you get a chance to hear CC telebriefing? Here's a chance to telebriefing. There is a great telebriefing from the CDC, and there's another webinar that they put together in regards to tips for healthy workplaces during the holidays. Listen to that one. That one is fantastic. They talk about ventilation issues. They talk about really great things. So fantastic. Once emergency sick pay standard is finished, will we have to pay employees while they quarantine if ill? Quarantine ill if they're exposed at work? Yes. I know you don't like that question, but yes, because the actual standard reads as you keep their pay, their benefits, their seniority, because it's not their fault they were exposed, right? And they were at an exposed workplace. So yes, I hope there was some relief from part of the government in that regard, but we can only wait because things are changing so often. If we offer testing but employee refuses, do we send them home for 14 days? Holy moly. Yeah, I have that other issue where people say, nope, I'm not going to get tested. And I'm just telling you, I'm not going to test. Yeah, send them home for 14 days. Absolutely. For test, no pay. Yes, pay them while they're waiting for test results. So who? Only the ones that you are paying for the test, right? So whenever there is an issue of positive case at the workplace and you are identifying workers that need to be tested and you're going to pay for this testing, also pay for the time while they get the test and the results. So a lot of you send them home and then you wait for the results and then they don't work for the rest of the day and then you can resume work according to the results. We did the general workplace notification at the beginning of the pandemic and it caused lots of overreactions among site employees. I bet. Yes. What if the positive person gives us their authorization to tell potentially affected employees? Let's see. What if the positive person gives us their authorization to tell potentially affected employees? Would that be okay for us to give their name out? No. A lot of them will say, and I don't care if you tell them, don't follow the rules. So you tell that person, I'm sorry, I just won't do that. I will not do that. Just don't do it because it violates regulation and they may take it back. So you don't want to do that unless, why would they do that? It doesn't even make sense. But some people will tell, I don't mind if you tell them, I want them to be safe. And some people are very nice. Still don't do it. Follow the rule. Both the positive employee and the coworker were both wearing masks. Do you consider this close contact? Yes, if they were within the 6-15-24 rule. Okay, so I like this question. Both the positive employee and the coworker were both wearing masks. Do you still consider them close contact? 6-15-24 rule. That's what you are going to take a look at when you are making a determination as to who needs to be tested. Of course, either if there's an outbreak, something different applies, and that's exposed workplace. And when you talk about the actual definition of an exposed workplace, and you have to take a look at the standard and read it, but that's basically all those areas where that person was making an interaction. So they don't talk about whether or not they have, obviously they're going to have face coverings. All of them are going to have face coverings, and you're still considering them potentially exposed. Great question. This is protected leave just like the other protected leave. Yep. Will this recording be available to us? Yes, this recording will be available to all of you. It's 12:26. Guys, I got through all of your questions. That's awesome. If anyone has more information, or if I've misspoken in any way, because this is all new, please tell me so that we can actually make sure that everybody gets the right information.